And please feel free to put any comments or questions that you have in the chat as we go along, but we will have a dedicated Q&A session at the end. So thank you all very much for showing up this morning. We're delighted to have you here. And now I'll hand you over to Rebecca. Rebecca? I think you're on mute.
Thanks very much, Valerie. Do we have the presentation there?
Yeah, it's coming now.
Great, that's lovely. Yeah. Well, listen, just to add to Valerie's words there, you're all very welcome this morning, and it's really great to be linking in with you again. We learned so much from that event that I think a lot of you would have attended back in November. And definitely the development of this call is we really very much hope you'll see what you are telling us reflected in this call. So really what I want to do is just very quickly set the scene and the bigger picture this morning, and then I'll hand over to Sarah to do something similar from the health perspective. So as Valerie said, I'm the team leader here in Creative Ireland, the Department of Tourism, Culture, Arts, Gaeltacht, Sport and Media. Now, a lot of you will have seen this slide before. It just reminds us, though, I think it's very important to remind ourselves just what's at the heart of the Creative Ireland mission, because each of these objectives, embedding creativity in public policy across government and showing how culture and creativity contribute to well-being and social cohesion, we could not achieve either of those objectives or make any progress in either of those objectives without partnerships like the one we're building with you through this call. And it is a partnership, obviously, of course, that the team has done so much to build over the last couple of years. So what we want to do with this call is support you to do more of what you know works well. So we just moved on to the next slide there, Valerie. So I just hope when we were putting together this slide, I just thought it was really interesting to juxtapose these two definitions. One is one of our working definitions of creativity, and the other is the World Health Organization definition of health. So quite likely some of you or many of you will be very familiar with one of these, but I thought it was interesting to put them both beside each other, because what we're trying to do here is bring these two worlds together, the world of creativity and health. And often we hear, and we talked about this last November, well, how do we get the two worlds talking to each other? How do we get them to talk each other's language? And that's a really big focus of this scheme. How can we make just another step forward? How can we keep up our progress on bringing these two worlds together? And what that will help us do is actually help us develop a sustainable operating model for what our vision is of what arts and health can be in Ireland. And I know our colleagues here from the HSE, including Sarah McCormick, are so keen to learn from you about that. And that'll be such an important outcome of this scheme that we feel. So then moving on, of course, to the bigger picture, the great bigger world out there, I think it's really important as we do all this really important work with individual people on the local level, it actually is fueling a global effort on this. I think it's really important to remember that connection. And you, again, many of you will have seen this slide before from November, but what I'm focusing now at the moment is that culture for health piece. That's the EU piece. And I'm actually heading over now this afternoon, as it happens, to Brussels for a meeting on Tuesday and Wednesday of the very first Culture for Health working group, where all the member states are coming together with the European Commission to see how we can advance this together. And it seems to me like this working group is very focused on developing practical resources for us all to use and on giving arts and health a key place as part of the EU mental health strategy. So we'll watch this space, and I'll be very keen to report back to you on developments at our event on the 22nd of May, which I think we've flagged to already to save the date. So then just my very final slide then is just want to remind us all about, again, coming back to the point of collaboration. Obviously, we want you to collaborate together in a new way as local authorities working in partnerships to start that process of alignment with the new HSE health regions. We know it won't be an exact fit at the moment, but that's where we want to start moving towards. And just to remind you again that that is underpinned by collaboration across government. And it'll be really interesting to see how this slide develops in the coming years as we take on the shared island dimension as well for the first time. And we'll be really keen to hear ideas and approaches that some of you will have on that. So I just want to finish again by saying thanks so much for coming this morning. We're really looking forward to your questions. And what I might do now is hand over to my colleague, Sarah McCormick.
Okay, thank you very much, Rebecca. And I think it's so nice and thinking here. Rebecca's coming here. She's coming here in the arts world, and I'm coming here in the health and wellbeing world. And the marriage is coming together between the two of us. And I have to say, it has been wonderful work since I first started working here on behalf of the HSE with Creative Ireland in relation to what we want to do from an arts perspective. So we can go to the next slide. So the first thing is that what I just remind us here is what brings us together and what is making this marriage, and that is Healthy Ireland. And reminding ourselves that Healthy Ireland is that framework that was launched by government in 2013. It's a long framework. It's taken us up to 2025. Why was it actually launched there, and why are we so focused in relation to health and well-being? It's because there is a never increasing rate of chronic disease, and I've called out examples of some of those chronic diseases. And when you see them there, the diabetes, the stroke, or cardiovascular, none of us want to get those diseases. And the thing we'll always ask and say, can I prevent myself? Can I keep myself healthy and well? And the answer to that is that yes, in the main, you and I and all of us can prevent ourselves from getting those cardiovascular diseases. But it's not easy. You see out there what's driving those chronic diseases, and they're driven by our modern environment, our modern lifestyle, and which is leading towards, as you can say, all the nice things that we like in life there that's in it. So the call out there in thinking all the time, not to smoking, avoiding harmful use of alcohol, healthy eating, being active and looking after our mental health, and very much in there, social connectivity and being able to manage stress within our lives. Next slide, Rebecca. So thinking of the Healthy Ireland framework and why we're here, just go back, why we're here around the table today is the one that actually it has the Healthy Ireland framework has 4 key goals in what it wants to achieve. And one of those key goals that's actually there, I know Rebecca is just flicking through the slides, but one of those key goals that's actually there, that's just that one there, that's right. The one that I'm just pointing for today and this morning is that one, which I really think is a lovely goal. It's about creating an environment where every individual and every sector of society can play its part in achieving a healthy Ireland. Because it is well known that to prevent chronic disease, to change the way we live our lives and to adopt healthy behaviours and create an environment is not just health service alone. It actually takes every one of us in society, and it takes all our partners, and that's a key part of where we are around the table this morning. Next slide. And in linking that, when we talk about partnerships, we in the HSE launched our Healthy Ireland implementation plan in July, in taking us up into 2027. And a key part that's called out there, equal with the other 3 priorities, is about strengthening partnership and community working, because we know that, and the evidence shows that it's only in that partnership we're going to make a difference for the people that's living in our island here. And that part of we are living longer, but we are not living with a quality life. So it's strengthening partnerships, which is what we are doing this morning here, and the work in relation to arts and health. Next slide. Now, we all know that there are plenty of underlying policies, plans and strategies, but it is a challenge to implement them and to turn them into meaningful actions for our public and our population. And as Rebecca has said, there is plenty of evidence to show how arts and creativity can actually improve health and well-being. And this is the real trick. And this is the greatness of this marriage, about how we can use the creativity and the greatness in the art to be able to implement the evidence base and what we know works and has the sustainability in what we actually do. Next slide. So, bringing us here this morning in working with the local authorities. Our aim is that in working with you, that we will have that strong partnership. So we know that this is at a county and a by-county level, so for 2 or more counties to come together. So we in the HSE want to come together as a team working with you in partnership. So for each county, we will identify a Healthy Ireland hospital representative and a community healthcare organisation, health and wellbeing representative, to work in partnership with the local authority Creative Ireland team in the developing of proposed projects. We will talk health and we'll talk about strategies and talk about what we need to do. You will bring the wonderful creativity of arts and poke our minds and get ourselves thinking in relation to it. We will share contact details of people to contact in the HSE, and vice versa. We will share back into the HSE the people in relation to Creative Ireland. Next slide. This then brings us around the table. Let's start having those conversations. And I see them as being really rich conversations that we can actually bring the two worlds together, the two languages together, and we can come up with wonderful proposals to submit in there into Creative Ireland, going in for yourselves in the local authorities, of which then with joint partnership and working to make those a reality and improve the health and wellbeing of the population. Next slide, Rebecca, which I think is the end. So just I shared with you just some useful links there that you have in relation to lots of information that we actually have with it. So that's the end, and happy to take any questions that come as we go through the session. Thank you very much, Rebecca.
Thanks a million, Sarah. Very much appreciated. A lot of information there and great collaboration I foresee happening in the future. I'm delighted to say that John Leodont has managed to join us from the Department of the Taoiseach. So we'll hear a quick word from John just in relation to the shared island element of our call this year, which we're very excited about. Thanks, John.
Thanks very much, Valerie. Good morning, everyone. So as Valerie mentioned, my name is John O'Lidon. I am the Assistant Principal here in the Shared Island Unit located within the Department of the Taoiseach. And over the next 3 minutes, I'll give you an overview of the Shared Island dimension to both this programme and also the Creative Ireland programme more broadly. So I'm conscious that there may be some people on the call this morning who may not be familiar with the Government of Ireland's Shared Island Initiative. So the Shared Island Initiative was launched in October 2020 with the aim to engage with all communities and traditions to build consensus around a shared future and to harness the full potential of the Good Friday Agreement to enhance cooperation and mutual understanding on the island. So over the last 4 years, we have worked with all communities and traditions on the island of Ireland to build upon the promise of the Good Friday Agreement. We've done this in 3 main ways. The first way is through our Shared Island programme of research, where we have tried to move past the anecdotal understanding of issues on the island of Ireland in areas such as productivity, health, education, common concerns that impact upon all people on the island. And over the last 4 years, in partnership with the ESRI, we have published a large number of publicly available research outputs on each of these areas. Secondly, as part of the Shared Island Initiative, we have engaged in dialogue with over 5,000 citizens over the last number of years to get a greater understanding of those common concerns. We've looked at areas such as tourism, sport, health, and also the area of arts and creativity. There may be some people on the call this morning who attended an event we held last year in Belfast, where we brought together stakeholders across the island of Ireland to get a better sense of what could be done on an all-island basis in the area of arts and creativity. And this has very much informed the Shared Island Fund and how it's been programmed in relation to arts and creativity. And then, as mentioned there, the Shared Island Fund is a 1 billion commitment out to 2030 for large-scale infrastructure projects and then also projects that bring people together and communities together. Some of you may have seen an announcement last week in which over 800 million was allocated by the Government of Ireland for shared island investment opportunities, including the A5 contribution towards Casement Park, Carlingford Greenway, educational programmes, etc. And as part of prior allocations, €6 million was allocated to the Creative Ireland programme in December 2022. And the intention behind this was to enable aspects of the Creative Ireland programme to be programmed on an all-island basis. So over the last since 2022, colleagues in the department working with stakeholders in local authorities and in the arts and creativity sector more broadly have programmed a number of funding calls and initiatives. There has been 850,000 allocated as part of the creative community on the shared island funding call. There were 600,000 under the Creative Climate Action Fund. Recently the Creative Youth funding call was launched, which will provide 540,000 for projects for children and young people. And then the reason that we're here this morning is to talk about the funding that has been provided under the Creative Health and Wellbeing in the community call. So as you will have seen from the funding brief documents, under this programme for Strand 2, 350,000 has been allocated towards 5 projects, which will be programmed on an all-island basis. Again, some of you on the call may be very familiar with working on a cross-border basis, some of you less so. And the intention behind the Shared Island Strand to this funding call is to see what can be achieved when there is cross-border cooperation. As we're all aware, many of the issues that will be tackled as a result of this funding call are common in both jurisdictions. And it's about understanding how best we can collaborate to ensure better outcomes across the board. So in the funding call document itself, you will see kind of the criteria that's required for the Strand 2, for the Shared Island Strand. And we'll be very interested to see the applications from local authorities that are looking to engage with partners in the north to see how best they could collaborate. And then also during the Q&A session, very happy to answer any questions groups may have about how best to collaborate on a north-south basis if they haven't done so previously. But again, I'm very aware that there's a huge amount of knowledge within local authorities on cross-border collaboration. So we'll be very interested to see the projects that arise as part of this project. And then just to finish, all information in relation to the Shared Island Initiative is available on our website, so sharedisland.gov.ie. The slides here will be circulated afterwards, including our contact details. And if anyone has any questions more broadly in relation to the Shared Island Initiative, then please don't hesitate to contact. So I'll hand back to Valerie now, but thank you very much.
Thanks a million, John. That was very useful. Some people, you're absolutely right, probably haven't worked very much on a shared island basis, and we're hoping that this initiative will encourage more people to do so. So what are we looking for then in this call, and how much money have we got to spend? I suppose are two of the most important questions. For Strand A, which is in the Republic, we have €700,000 available in funding in 2024. We are hoping to have the same amount of funding allocated in 2025, and that'll be subject to our budgetary allocation at the end of this year. And what we're looking for are 10 arts and health projects in the community, in the HSE community hospital settings, at approximately €70,000 per project. Strand B, as John was saying, is the shared island element of the call. And we're looking for local authorities in the south to work in partnership with organisations in the north of Ireland. And that amount, that part of the call has €350,000 assigned to it. And we're hoping for 5 projects to be led by partnerships, local authorities in the south in partnership with the organisations in the north. So for both strands, the whole idea is to improve the health and the well-being of all age groups. Previously, you will be familiar with us having worked with people in older age, with the travelling community, with children with chronic illnesses. This call is not limited to those particular activities. This call is open to all age cohorts across the island. And social prescribing activities and end-of-life and bereavement can also feature along with positive ageing, but we're not being prescriptive as to what we want you to suggest to us or propose to us. You will know best what works in your communities, and that is what we want to hear from you. So at our event in November, our networking event was very well attended and I think very well received also. And what we learned from that particular gathering was that we need to continue to support to deliver creative health and wellbeing projects that meet the needs of people in their communities. So this is where the local authorities come in, and you will know what your communities need, and you'll be working in partnership with organisations in your community to deliver on projects that are going to improve their health and wellbeing. We also learned that support should span more than a year. So this year, for the first time, we are undertaking to provide support in 2024 and in 2025. Like I said, subject to budgetary allocation at the end of the year, but we don't expect that there's going to be zero in that pot. So participation in creative activity is absolutely essential to address social isolation and health inequalities. And we've seen this through very successful projects in social prescribing over the years and in other projects that have been led by Creative Ireland. And now we're looking to you to guide us as to what we should do next. And we should continue to build on the good collaboration between Creative Ireland and Healthy Ireland and a number of local authorities throughout their culture and creativity teams. And those teams on the ground are very strong now. We have Creative Ireland officers in all 31 local authorities, and we have 29 creative community engagement officers already assigned and 2 more waiting to start in the very near future. And that will be our full cohort. So we're absolutely delighted with that. So the objectives of the scheme then are to foster the collaborative approach that we know is already working very well, and to expand on the connections and on the relationships that you have built with organisations in your community. We also want to build on what we've learned from the projects that we supported since 2021, which are the likes of creativity in older age or the children with chronic illnesses. Any of the projects that we've supported already have been successful, and we just want to build on that now. We also want to leverage the capacity of Creative Ireland to align with Healthy Ireland and to advance its. We're delighted that the partnership with Healthy Ireland is going so well. It's only in its infancy, really, but we've already made some really good contacts, and Sarah has been fantastic, and her colleagues as well, in working with us on our joint aims. So to facilitate that collaboration going forward is really, really important. And then to build on the collaboration across all the local authorities in the country and hopefully align with the new HSE regions which are being developed. That'll mean that you will have the opportunity to partner with local authorities in neighbouring counties and in the new HSE regions as well. So we're not looking for individual applications from every local authority. As you would have seen earlier, we only have funding to support 10 projects throughout the Republic and 5 in the North. So partnerships are absolutely vital to the success of this call. And then to develop the potential of a shared island approach as well. And as John was saying, some of you will be familiar with working in partnerships across the North, some of you not so much. And it doesn't mean that you need to be in a border county either to get involved in this initiative. Somebody, the local authority in Cork might partner with similar organisations in Belfast or in different parts of the country. You don't need to be a border local authority to get involved in the shared island part of the call. So the scope of activity, like I said, we're not being prescriptive as to what kind of activities you can engage in. The only prescription, I suppose, is that it needs to be for the benefit of people's health and well-being and to be achieved through creativity. So for people of all ages who are experiencing social isolation, for older people, for traveller communities, for people experiencing difficult times in their life, such as end of life or bereavement, and for children with chronic conditions, but not limited to those groups of people, just a guideline as to what we may have supported in the past. And the all-important funding, like I said, is €700,000 available in 2024, with another 700,000 expected in 2025. So that allows us to support 10 projects up to 70,000 each in 2024 and another 70,000 in 2025. And for the shared island element, 350,000 in 24 with a similar expectation in 25. And that'll be 5 projects up to about €70,000 in each year. And in some instances, that might not be enough to allow large-scale projects to take place. So we certainly welcome co-funding. Any other public funds that the local authorities will be able to access, or philanthropy or business contributions, can all be included. And on the budget page of the application form, you'll find a space where you can state how much you're seeking from Creative Ireland and how much you might be expecting to achieve from other organisations that you can partner with as well. So the application requirements then for Strand A is that the application must be proposed and led by the local authority in partnership with organisations in your area. We want at least 2 local authorities to join together. So neighbouring counties or further afield if they're within your HSE area. except for Dublin and Cork, I suppose, because Dublin and Cork being so large, for them to partner with another local authority would mean that there'd be too many people or too large an area to cover. And the project must be developed and delivered in collaboration between the Creative Ireland and Healthy Ireland teams in each of the local authorities, in partnership with all those people there, the wellbeing officers, the Sláinte Care Healthy Communities people, and the other relevant officers and teams in your local authority. Strand B is similar, except for the fact that your delivery partners will be in the north of Ireland, and the partnership must be led by the local authority in the south. That is where the application will come from, but the connections and the partnerships will be with organisations in the north. Definitely, it must have a clear north-south basis. So we want to implement the broad objectives of the Creative Ireland programme and the Shared Island Initiative, and bringing communities together cross-border is definitely one of the aims of this strand. So all the applications will be assessed on the following criteria. The quality of the proposal in terms of meeting the programme objectives, which will be in the brief, the experience and the expertise of the team that will be leading the proposal, the anticipated value for money, and then the total marks available are 100. So we are aiming to have the closing date for the call, which I'll come to next, actually, is the 28th of March, and we're hoping to have some of the all of the applications assessed by the middle of May at the very latest. In your budget, costs that you can apply for can include, but definitely not limited to, artist fees, venue rental, documentation costs, networking or showcasing of initiatives. Things that can't be covered by the costs are costs not directly related to the project. That's a little bit obvious, but it's definitely important to say it. Retrospective costs, so any expenditure that may have taken place before funding was actually approved. We can't retrospectively fund anything, even if it is something to do with the project. And capital requests for building improvements or to workspaces and venues can't be considered either. And then the important dates. So the fund opened on the 19th of February, just a week ago now. And the 28th of March is our proposed closing date. The proposal should be submitted through submit.com by 5 p.m. on that day. And the link to the application form is in the email that you would have gotten, the e-zine. It's also in the briefing document. And we're aiming then to inform all applicants whether they've been successful or not by the middle of May. And as Rebecca mentioned earlier, we're having a follow-up network meeting on the 22nd of May in Dublin, and we've already issued a save the date for that, but more details will follow shortly. And at that event on the 22nd of May, it would be absolutely fabulous to be able to announce who the recipients are. Obviously, we'll have the results published before that, but to have input from the funded projects so that we can partner with them from the beginning and be involved from the very start. So if you have any specific questions that you prefer not to mention in the Q&A, obviously feel free to contact us at any stage. You can contact us at Creative Ireland at that email address, tcagsum.gov.ie. And also, we're delighted to take your questions now. So if you want to put some questions in the chat, or if you prefer to ask your question, just unmute yourself and we'll answer as best as we can. Thank you all very much. Sorry, Maura, if you can see the chat, can you see, are there any questions coming in, please?
Yeah, there's one there from Teresa Tracy. Does your partner in Northern Ireland need to be a local authority?
The answer to that question is no. We would imagine that your partners in Northern Ireland would be different organisations, so health and wellbeing organisations or creative organisations, but not necessarily a local authority at all, no.
So it could be a local authority, couldn't it, Valerie? There's nothing to preclude that. Yeah.
Yeah, nothing to preclude that, but definitely doesn't have to be.
The next question is from Annette Dupuy. Sorry if I'm saying that wrong. Can you please share again the funding documents or link? We can do that afterwards. Then from Magella Keating, just to clarify, is it 70,000 per year? And do we have to spend all by November 2024? She's unclear.
That's a very good question, and I should have said that during. Yes, it is 70,000 for 2024. with an expectation of another 70,000 in 2025. And the funding for 2024 must be spent by November so that you can claim it, sorry, November 2024. So you can claim your 70,000 for 2024 by November of this year.
Okay. The next question is from Denise Cahill. Can you please outline if the 70,000 allocation for cross-border funding needs to be split 50-50 between cities or local authorities?
That's a good question. The answer is no.
I can hop in there, Valerie, because the same question
Thank you, Tanya.
came up
Yes.
to John and myself up in the north for our Creative Youth on a Shared Island. So we don't have very specific breakdown that it has to be precisely 50-50. But I think what we would like to see is that there's a decent balance, that it's not all going to one jurisdiction or another, but there's no sort of hard and fast rule. I think that's fair, John. It really is what the project requires. It may be, for example, your transport is being purchased in the south and your accommodation in the north. So we take just so long as it's clear that it's very much a shared island project.
Absolutely. Just to reiterate what Tanya said there, as long as the interaction itself is meaningful, and then not to be hung up on the 50-50 split.
Thank you very much. That's very clear.
Okay. The next question is from Anne McAteer. Just wondering about a group of islands applying under their local authorities and linked to HSE services and healthy communities.
Well, maybe if I jump in there, that would be offshore islands, I presume. So yeah, so look, they're part of that local authority. So, you know, it's an area. Again, that's a matter for the local authority to identify the focus of the project.
And I suppose to add to that, Rebecca, and we would be very familiar with the islands policy in our Gaeltacht division and in the Department of Rural and Community. And we're aware that often islands that would be spanning a number of counties like, you know, Mayo and Galway or Galway and Donegal, sometimes the islands partner together, and that's totally fine with the particular kind of culture of island communities.
Okay, the next question is from Sarah O'Farrell. Should the application be for one distinct project, or can it be two, etc.? One project with young people and a distinct project with older people.
Do you want to take that, Rebecca?
Yeah, I mean, I think it's a question of you would be in the position to identify what your communities need. I suppose the important thing is that there's sufficient focus being put on being able to have a meaningful project of some scale. But if you feel that there's synergies between them and you feel you can reach those two different cohorts in a meaningful way, that's again, that would be your call. I suppose it's just to make sure then that there's a project of sufficient depth being carried out in each instance.
Okay, the next question is from Colleen Whirl. Does the objective of building on what we have learned from projects funded since 2021 suggest that our proposed project must be directly linked to a previous programme delivered in our local authority and funded by Creative Ireland?
No, it doesn't have to be. It's just we're conscious there's been a lot of work done, a lot of great work done. And if there's an opportunity to build on that, that's again coming back to what we had heard in November. If you want the opportunity to build on something you've done before, but it absolutely doesn't have to be. The whole point is we want to hear from you what you feel where the potential is to act.
Okay, the next question is Denise Cahill. Can we partner with more than one local authority in the north, for example, Derry and Belfast together?
Yeah, there wouldn't be a problem to that, absolutely. I mean, John, I don't know if you want to come in on that, but I think, yeah, depth of partnership would be great, wouldn't it?
Absolutely, Rebecca. And I think it would be good to see kind of, as long as the interaction itself is meaningful, be it with local authorities in the north or with other groups that are active in the space in the north. So again, it'll just be a case-by-case basis when we get the applications in.
Okay, the next question is from Teresa Tracy. Will there be another call out for the additional funding for 2025, or will it be further funding for existing projects?
Do you want to take that one, Valerie?
Yeah, so no, there won't be another call out in 2025 is the short answer to that. The idea of the 2-year funding is so that the projects that are initiated in 2024 can be extended into 2025 and build on what they do this year. So there won't be another call. The projects that are successful in 2024 will be continued into 2025 with further funding.
Okay,
That
the
was
next question.
An
sorry.
important message we heard from you in November, so we're really keen to act on that.
Exactly, yeah.
So the next question is from Anne McTire. It's McTeer, sorry, it's actually the same question again, so I'll move on. Emma Carmody is next. So the HSE Southwest region includes only Cork and Kerry. If Kerry cannot partner with Cork, how should we approach applying for Strand A?
I would be inclined to think perhaps come to us bilaterally on issues like that. You know, obviously we'd be very keen to support people, and you know, but if there's individual circumstances arising, obviously we can talk to you bilaterally about that.
There's also we're advising that if at all possible, you would partner with people in the same HSE region, but that's not an absolute. So, for example, if there's the opportunity for Kerry to partner with Clare, which would be close by, or Limerick, that could be a possibility as well, but you could come and talk to us for sure.
Right. The next question is from Louise Tangney. In terms of the Cork and Dublin areas being too large to join with another local authority for this funding, does this apply to both city and county in Cork?
Yeah, I think that's a good question. It was purely a logistics element that we considered that if Cork and Dublin were to try and partner with other local authorities, that they could be inundated. Like there's so many different areas within Dublin that the 4 areas within Dublin could partner together, and that would just be a Dublin application. And similarly in Cork, Cork City and Cork County could partner together and do one Cork application.
Obviously, what we're trying to do is balance I think that's quite generous funding, but at the same time it is limited. So the kind of funding we have is for supporting these projects of innovation. So we're trying to strike that balance between being able to support as many players as possible, but also recognizing the kind of realities of the structures out there. But again, look, come and talk to us about it. You know, that's the great thing about working through local authorities. It's of a scale in terms of number of stakeholders that we can deal with you bilaterally and individually on it.
Okay, the next question from Anne-Marie Laffin. Can the proposed project use more than one art form with the same group? Could we partner with CAMHS, for example?
Yeah. Oh, I think
absolutely.
Great, more than one art form. That absolutely be really interesting to see what people can come up with like that.
Yeah, absolutely. Like we said, we're not being prescriptive as to what kind of art forms or what kind of activity, creative activity that you're involved in. So more than one is absolutely fine.
Okay, the next question is from Siobhan Mulcahy. Can we submit more than one proposal per area? Also similar to the question about the 50-50 split in shared island funding, if a group of 3 local authorities apply, is there an expectation that the funding will be divided equally between them?
Yeah, I think perhaps if we take the first bit first, can we submit more than one proposal per area? The idea is we want to, I suppose, get as you maximize the use of our funding. So there should be a lead local authority, and as the brief says, it is just one application from that partnership, because obviously the funds are unfortunately limited. But also it would be a matter for the partnership to decide then how the funding would be divided between them.
Yeah, and the really important part of that is one lead applicant, even if there are multiple local authorities partnering together.
I'm going to Annette Dupuy. This is the final question. With approvals only in May, does the 2024 funding need to be all spent in the remaining months of 2024, or can some carryover apply?
The answer to that, I suppose, is that the funding for 2024 needs to be expended by November 2024. Our financial year will end then, and budgets can't be carried over into 2025. So even if it was possible for activity to take place in January, but the bills, if you like, be paid before November, well, then we can fund that in November, but we
The
wouldn't be able to
drawdown
carry it
has
over.
to be completed by the middle of November. That's really
Yeah.
important. But if
Yeah.
you think about the experience you will have had, or colleagues of yours, if you're newer to the area, will have had in the local authorities, funding of the kind of scale we're talking about when you do distribute it across the partners within the applying partnership, that should be a manageable amount of money to expend in that time frame, you know, if you look back at previous experience. And bear in mind then, as the support is continuing through 2025, obviously you'll have that extra period. You can be planning well ahead of time then for activities to continue right from the start of 2025.
I might just add in, Rebecca, because there's obviously, although there's plenty of people from local authorities, there's outside partners on this call. And I want you to be reassured, we absolutely welcome outside partners working with local authorities. I think many of the local authorities on this call would say they're not going to be in a position to project deliver themselves. So we absolutely recognise that there are a range of existing people in the arts and creative space who work in health and well-being, and we would envisage that some of those people would be applying with their local authority. So partnerships and collaborations are welcome.
Definitely. Thanks for that, Tanya.
We have 2 more questions. So from Annette again, are coordination or project management costs allowed?
Yes, they would be absolutely vital to the success of your projects. So definitely those kind of costs are allowed. If you have any specific questions in relating to budgets as you're filling out your application form, though, please feel free to contact us and we'll be able to guide you then. But the answer to that question is yes.
Okay, the next question is from Donald Tinney. Are there any formalities or documents required by Creative Ireland to authenticate the partnership structure, for example, MOU or SLA?
I think, Donald, I think are you talking about 2 things? Like, we'd want to understand that you were getting into bed with somebody, that there was an agreement in place, that you hadn't just stuck their name down on the application form. So, but you'd be uploading that to submit.com, an explanation about the partners, whether they're local authorities or outside people. But Valerie might turn to it won't be the subject of a separate SLA. And that's a good question, because sometimes when we get money, like from our colleagues in the Department of Climate Action, we have to do a separate SLA with you. That isn't the case here.
Yeah, so this will be done by amendment, which would happen quite often to the SLA or local authority has with Creative Ireland. So again, that will help the implementation time once the application evaluations are completed.
Yeah.
That's all the questions.
Thanks, Millie Moore. And thank you very much, everybody, for those questions. We will put up an FAQ section on our website as well, so we can put some of those answers in there. And if any more questions arise or any more issues you want clarified, please do feel free to contact us. You have our email addresses, and also your local coordination officers in the local authorities will be in contact with us quite a lot. And we'll be having a follow-up network meeting, like I said, for the local authorities and for Healthy Ireland and partners in May on the 22nd. And we look forward to seeing a lot of you there. So if that's all the questions for now, thank you very much to everybody for taking part this morning. We really do appreciate you taking the time out. Thanks to John and to Sarah, Rebecca, Tanya, everybody, all partners for taking part. And we look forward to working with you. We're very excited to see what kind of applications we get and all the projects that are proposed. And we'll talk to you again soon. Thank you very much.
Everybody.
Thanks so much. Bye.
Thank you.
Thanks all.
Bye-bye.
Thank you. Bye.
Thank you. Thank you. Bye, everyone.
Thank you. Bye-bye.